All right. Hi, I'm Dr. Sheehan from Sheehan Natural Health Improvement Center. And right now, we're going to talk about magnesium, okay? How you figure out whether you have a deficiency in it based on your blood testing and symptomatology. Magnesium is a little bit tricky as opposed to the other ones like vitamin D, liver enzymes, blood sugar, stuff like that, because just because you have low levels in your blood does not mean you'll tend to have low magnesium, and just because you have adequate levels in your blood does not mean that you have enough. So you have to basically correlate your clinical signs and symptoms along with the blood testing, okay? So the signs and symptoms of magnesium, the big thing is that people are constipated, okay? Almost everybody that has a magnesium deficiency has constipation. Not everybody, but almost everybody. And when I see magnesium low in the blood, which is, by the way, I don't know, your magnesium level in your blood should be above 2.2. And here I was saying that if it's under 2.2, correlated to your symptoms, which shows a deficiency. So just remember, it should be over 2.2. I see your point, Jen. Oh. Jen made these I can't write very well. Anyway, but if you see magnesium below 2.2 and that person's got constipation, that's a home run, that person's magnesium deficient, okay? Also, very highly correlated with depression, muscle spasms, blood sugar issues. The higher your blood sugar, the lower your magnesium. It's also associated with anxiety, pain, and especially chocolate cravings. Let me see if there's something else that it's associated with. Those are the primary things that you're going to look for. If you go through this and you say, hey, I'm constipated, I'm depressed, I've got back spasms, my blood sugar stinks, I've got anxiety, I don't sleep that great. Oh, insomnia is another good one in there. But insomnia, and I crave chocolate all the time, and you have a magnesium blood level of like a 1.9, you're probably magnesium deficient, okay? So, what do we do about magnesium deficiency? Well, what you want to do first is get on the right diet, which is called the PAGE diet, okay? We have another link below for that. Basically, if you have blood sugar problems, you go on PAGE phase 1. If you don't have blood sugar problems, you go on PAGE phase 2. And then you supplement with magnesium. And I'm going to tell you there's 4 different companies. Primarily, I will tell you which ones I primarily use. Okay, I'm sorry. 3 different companies. I primarily use standard process and systemic formulas for this, okay? Here, by the way, we're going to cover zinc in a couple minutes here, so they're on the same chart. But magnesium, okay, you're going to look at standard process, and there's 2 different forms that standard process has. We've got magnesium lactate. Magnesium lactate is the one that I go to first. I think it's cheaper than Easy Mag. Also, it's a higher dosage, and I tell people, all right, usually I do what's called muscle testing, nutrition response testing, and people test between 3 and 6, and what I'll tell them is, let's say they test for 6, and I give it to them, and they say, I started getting diarrhea, then you need to cut down to 3. It's that easy. And there's also something called Easy Mag from Standard Process. Easy Mag is really cool because it's a very bioavailable form, and they do have studies that show that it increases levels of magnesium in the brain to decrease depression and anxiety. Very cool. I've seen the studies, even though it's a very low dosage. Sometimes you don't need a huge dosage of something. You need an effective dosage, okay? It's just like having, a little hammer and a huge sledgehammer. Sometimes you need a little hammer in the right place to hit that nail in instead of a huge sledgehammer in the wrong place. We also use a company called Systemic Formulas. Systemic Formulas has 2 formulas primarily for magnesium. It's called Cal MD Liquid, which is basically calcium, magnesium, and D liquid. And so it's formulated for bones, but it's going to have magnesium in it. And there's also something called Min. Min is short for mineral. What's cool about minerals, a lot of people, when they come in, the reason why they have low vitamin mineral levels in their blood is because of the fact they don't digest properly. And indigestion, poor digestion, digestive inflammation is rampant in this country. And so a lot of people, when they come in and they show low magnesium, I'll actually give them min, okay? Min, it's a pretty high dosage. It's magnesium oxide, which is technically not the best form, but I find it does work. And so I test for that a lot. It also has things like iodine, copper, selenium, and some of the other minerals in there, which are very, very important. A little bit of calcium, not much. And then NutriWest is another company we use, aspartic multimin. I don't tend to use them because of the fact I use mainly min and magnesium lactate and a little bit of Easy Mag. But if you don't have systemic formulas or standard process, you can use NutriWest. Okay? For the doctors that test, like I said, I do nutrition response testing. There is a point on right here where the clavicle meets the sternum, and that is called a mineral point. If you test that, the person goes weak, you have them hold mineral where they have level below 2.2 on their blood test, and they show signs and symptoms of magnesium, you're going to hit a home run when you give them magnesium. Okay? Thank you very much.